Hello and welcome to another episode of the Talking of Minds podcast. In this episode, we will be looking at the relationship between the practice of yoga and mental health. Specifically, we will be looking at the scientific evidence available by way of meta-analysis or systematic reviews. Now, systematic reviews and meta-analysis are considered to be the highest form of reliable, evidence in science. Even though you cannot blindly say or blanket, you cannot give a blanket, approval for all meta-analysis. But meta-analysis or systematic reviews are considered to be the most reliable kind of evidence available in scientific research, and meta-analysis are conducted on published studies. So you take all published studies which are available in a specific topic, and you collect data from these studies and do analysis of them in order to find a comprehensive picture of scientific knowledge on the specific topic. So we will be looking at the practice of yoga and its relationship with various topics related to mental health, such as the treatment of some mental disorders including depression and enhancement of positive mental health. Whether yoga has been found to have any relationship with these things. And before we start, there has to be another finding which warrants our notice. So this comes from a systematic review of randomized controlled trials published in 2015 in the journal Contemporary Clinical Trials. The paper itself is titled, "Are Indian Yoga Trials More Likely to be Positive Than Those from Other Countries?" And the study says that RCTs or randomized controlled trials on yoga that are conducted in India have about 25 times the possibility of reaching a positive conclusion when compared to studies conducted elsewhere. This is the big gap, and they say that Indian trials should be dealt with carefully when evaluating the evidence. So there is a clear case of publication bias or bias in research, which we have to be careful about when evaluating published studies. It has also been found or noticed that many times possible conflicts of interest have not been adequately revealed by funding agencies or authors. These conflicts of interest may happen when a study is conducted by or a study is funded or sponsored by an institution or a group of individuals who are already in the practice of yoga. And we know that yoga is a very big business worldwide, and there have been a number of institutions who do research and who also market yoga as a complementary or alternative medicine or a lifestyle exercise and all, and many of them may be deriving huge profits from these businesses also. So there has to be we have to be careful about a conflict of interest when such institutions or individuals publish such studies on yoga. And now this conflict of interest is also to be seen in many cases. Moving on to the available evidence on the relationship of yoga with various mental topics related to mental health, such as depression, anxiety, PTSD, etc., or the enhancement of positive psychology. If you look at depression, the case of depression is one of the most common or widespread mental illnesses, and you can see hundreds of articles on the internet claiming the effect of various remedies on depression, and yoga is definitely one of them. And the available evidence on the effect of yoga on depression says that positive effects of yoga, if any, are consistent against passive control groups only and not with active controls. Now, what are passive controls and active controls? Passive control group is a group of people who do not do anything. In the case of depression and yoga, so we'll have a group of people with depression undergoing yoga. They will be called the experimental group, and they will have a control group. And a passive control group is people who are having depression, but they do not do anything which is comparable to yoga as a treatment for depression. And there will be active controls who will be doing some activity which we can compare to yoga, to compare the effectiveness of these two. So positive effects of yoga in depression are consistent only against passive controls or people who do nothing, not with active controls. And similar results of passive controls or people having better effects of fighting depression exist for many other treatments, including aromatherapy with lavender extract, dance movement therapy, physical activity, plain physical activity or exercise, music therapy, etc. And by far, from going through meta-analysis, we can see that dance movement therapy is found to be one of the most effective interventions in the treatment of adults with depression, other than psychotherapy or medication, which are the standard treatments for depression. And there were studies which compared the effectiveness of various complementary and alternative medicines, including depression. An analysis of systematic reviews from 2019, it compared the effects of various treatments, including acupuncture, St. John's wort. St. John's wort is a plant whose extracts and flowers, etc., are used in many places of the world. Yoga, dance therapy, mindfulness-based interventions, music therapy, light therapy, Tai Chi, saffron, the use of saffron, Chinese herbs, etc. And it was found that moderate quality evidence for the efficacy of St. John's wort when compared with placebo was found in the treatment of depression. It was somewhat comparable to antidepressant medications itself. St. John's wort is used in many parts of the world, especially in the Americas, as a supplement, a herbal supplement or something, where its extracts, etc., are used in various forms. And St. John's wort was found to have significantly less adverse events than any of these other treatment modalities. And mindfulness-based cognitive therapy was also found to have comparable effects to antidepressant drugs, especially for the recurrent major depression, variation of depression. And all others, including yoga, acupuncture, etc., were considered as having low or very low quality evidence. And a possible high risk of publication bias found in yoga studies, which we already discussed. And adverse events were not considered, and this is another problem with yoga studies, because the adverse events related to the practice of yoga are not adequately covered or documented in studies, and there are not many specific studies which look at the adverse events of yoga when used as a treatment modality for mental illnesses. And anyway, you can see a number of articles across various social media, etc., claiming the effectiveness of yoga in treating depression and all. And most of the times, if you look at this published studies on those, we can find in the conclusion part or etc., where they say that yoga can be used as a form of physical activity. That's what these most of these studies actually look at. But when media shows it to us, they may give different kinds of misleading titles and all. Now, from depression, we will look at the available evidence there regarding anxiety. Anxiety is another widespread, symptom of, a group of disorders called anxiety disorders. And as of 2018, there was no conclusive evidence for the effects of yoga in the treatment of anxiety disorders, and no effects were found for patients with anxiety disorders who were diagnosed by the criteria according to the Diagnostic and Statistical Manual of Mental Disorders. With regard to schizophrenia, moderate evidence for short-term effects of yoga on quality of life was found in people having schizophrenia, and this study was published in 2013. We have not much meta-analysis published afterwards with regard to schizophrenia. And it has to be said that it was not on the treatment of schizophrenia, but rather on the quality of life of people having schizophrenia. And the paper itself says that no recommendation can be made regarding yoga as a routine intervention for schizophrenia patients. Now, so that's about the evidence on schizophrenia. And now, with regard to people who have undergone psychological trauma, meta-analysis published in 2020 says that effects observed for mindfulness, yoga, and integrative exercise were similar, and none of these was in any way better than any other in the treatment of psychological trauma. Another area of studies where we have meta-analysis evidence is the treatment of post-traumatic stress disorder, or PTSD. And a meta-analysis published in 2018 found low quality evidence for any statistically significant and potentially clinically relevant effects of yoga on the symptoms of PTSD. So that's the evidence available for PTSD and yoga. And these are some of the mental illnesses in which meta-analysis studies have been published with regard to the usage of yoga as a treatment modality. And with regard to positive mental health is something that we desire to have. It is mental health itself is much bigger than having no mental illnesses. Mental health also means that you are able to find happiness, you are able to function effectively, you are able to find happiness and satisfaction, and all those come under the umbrella of positive mental health. And yoga there was a study which was published in 2017, a meta-analysis which said that in comparison with normal physical activity, yoga does not provide any evidence for a significant increase in psychological well-being. So yoga can be used as an intervention for psychological well-being, but it does not offer any better effects when compared to normal physical activity. And for life satisfaction, social relationships, etc., which are also part of positive mental health, no significant effects for yoga were found over non-active, active or non-active control groups with regard to positive mental health. And yoga had the same effects on the pain and disability as any other exercise or physical therapy in the case of chronic low back pain. Now, chronic low back pain is one of the very widespread physical difficulties present in our times, maybe for the past 20-25 years. And a study or meta-analysis that was published in 2020 said that yoga had the same effect on pain and disability as any other exercise or physical therapy for the treatment of chronic low back pain. And there was no significant difference on physical and mental quality of life between yoga and any other intervention with regard to as the usage of physical activity. And in general, if we look at whatever studies that we have discussed so far, it can be said that the risk of bias is generally high in with regard to yoga studies. So that has to be improved if you want to find credible evidence for the usage of yoga as any kind of a therapy or a treatment modality. There have been methodological issues with many of the randomized controlled trials conducted with regard to yoga. And any effect that have been found so far are in comparison with inactive controls, or people who do not do anything. So in comparison with active control groups where people do some kind of a therapy or another therapy modality, or people who engage in physical activity, etc., we have not found much of promising evidence for the effectiveness of yoga. And adverse events are usually neglected or not appropriately reported in studies related to yoga. Nevertheless, the media coverage or popular perception may picture a very different scenario And for the sake of science, for the sake of scientific temper, we have to be careful when interpreting such studies and evidences, not only for yoga, for any kind of treatment modality or a complementary or alternative medicine or so-called traditional medicines or anything. While analyzing the effects of any kind of such treatment modalities, we have to be very sure, very very careful about analyzing the available evidence. So that's about the relationship between or the published studies related to yoga and mental health in general. Thanks for listening.